Good afternoon. How's everyone doing?
Great.
First, I want to talk about if when a person has had a stroke and you're in a facility for a long period of time, and if you feel like the person's being neglected or you have some type of concerns, you can contact the Buzzley Crisis Line, and they will help with concerns about the quality of care provided to residents in long-term care facilities. They help with residents' right issues, dietary concerns, physical abuse and neglect. They also talk about any questions that you have regarding transfer or discharge issues, privacy and confidentiality, and they also can be a witness of advanced directive and skilled nursing facilities. But they have to be in a facility to get the ombudsman service. And that number is, if you guys have a piece of paper, 209-468-3785, or the crisis line, 800-231-4024.
Is there another place that they can go to get this information if they don't have a pencil right now?
Oh yes, they can talk to me after or give me an email. I give them my business card. Okay. The three programs that I focus on is information and assistance, linkages, and family care support program and grandparents program. INA, which is information assistance, initial contacts. If you have to complete a referral, normally the nurse at the facility or social worker at the facility will call us 209-468-1104 to complete a referral, letting us know that the client is being released from the hospital and what services that they think they may need. We complete the referral and then we pass it out to the different departments that we feel like will be compatible to the client. I get a little nervous, so bear with me. And those services that we may refer them to as linkages. And linkages is a program where we link the client to different resources. We provide case management, home improvement. Say, for instance, if a client needs a grab bar or a wheelchair ramp, if they qualify for the services, we can help them and provide that to them with no cost. We also offer transportation vouchers, respite, just in case whoever's caring for the client needs a little break. We can provide that as well, because I know it can be overwhelming sometimes. We also offer in-home care. We have contracts with private providers that can go in the home and provide help with bathing, feeding, clothing, or etc. And that's normally up to 20 hours per week, but our linkages programs is primarily short-term. It's not long-term.
Is everything income-based?
The requirements are you have to be 18 years or older, experiencing difficulties that put one at risk of living independently. Linkages, no income. It's not income-based. The next program that I will talk about is the family caregiver support. If you have an adult that has children but has had a stroke and they need assistance, we can make a referral to the grandparents. And the grandparents can be the caregiver for the children. It's a non-paid program, but we offer case management, home modification, and also we have a relationship with SCAN, and we just received funding of $20,000, and we can provide up to $500 per client, but they have to be referred by someone who works at the hospital or facility if they're going back into their home. We also education regarding if you need, like I said, we link people to services in the community that they have no knowledge about, and that's how we are able to assist them by providing education to them. Like I said, home repair, transportation. Also, we have a Meals on Wheels program. I have the number to that as well, and that's when meals are delivered to homebound seniors who are unable to actually go out and get their own food. We have a program called Meals on Wheels. The eligibility must be 60 years of age or older and homebound. And if you don't meet that qualification, we have different programs in the community, like community centers where we offer commodities and brown bags. That's free food. You just have to sign up for it or go to the community center in your area, and I can provide that via email as well. If you have questions regarding Medicare, Social Security, I have the email. I have the website for that information. Also, we link people who have questions about insurance, health insurance, and that need counseling and advocacy program. I have that information as well. But mainly our goal is to help provide services to the community and make sure that they're knowledgeable of what we have to offer.
That's it.